Hello, my name is Zhou Tony Su. I'm a urology resident at the Brady Urological Institute at Johns Hopkins. I am delighted to share with you our research findings regarding diet patterns and prostate cancer disease progression during active surveillance. Prostate cancer is the second most common cancer affecting American men. Prostate cancer is associated with favorable outcomes if it's identified early. For men diagnosed with low-risk disease, active surveillance rather than immediate treatment via surgery or radiation has become established as the preferred initial management strategy. The goal of active surveillance is for physicians to actively monitor prostate cancer and to offer treatments only if and when prostate cancer treatments become necessary based on evidence of disease progression. Therefore, active surveillance can delay or even avoid prostate cancer surgery and radiation treatments and the associated harms. For men with low-risk prostate cancer pursuing active surveillance, many are highly motivated to modify their diet and other lifestyle behaviors in order to reduce their risk of disease progression. However, there remains very limited evidence regarding whether any specific diet patterns may influence the risk of prostate cancer disease progression during surveillance. To address this important unanswered question, we use data from the Johns Hopkins Active Surveillance Program. Established in 1995, the Johns Hopkins Prostate Cancer Active Surveillance Program is one of the largest, longest-running, prospective active surveillance cohorts in the world. In this study, we included nearly 900 men enrolled in our program from 2005 to 2017. All of these men were diagnosed with group 1 prostate cancer at the time of enrollment and were monitored for a median duration of nearly 8 years on active surveillance. At the time of enrollment, these men completed a validated food frequency questionnaire to report their typical diets. From these completed questionnaires, we were able to analyze these men's typical daily intakes of various foods, beverages, nutrients, and overall diet patterns. We found that men consuming a plant-based diet experienced a lower risk of their prostate cancer progressing from group 1 disease to group 2 or higher disease during active surveillance. In particular, we found that consuming a plant-based diet is associated with a significantly lower risk of disease progression to group 3 or higher disease during surveillance. The latter finding is especially significant because for men with group 3 or higher prostate cancer, radical treatment via either surgery or radiation is universally recommended by physicians. So, what is the definition of a plant-based diet? A plant-based diet is a flexible dietary approach encouraging people to consume plant-based foods for the majority of their caloric intake while limiting animal products and processed foods. Examples of plant-based foods include grains, fruits, vegetables, beans, nuts, and seeds. There are important limitations to our study. The most significant is that our study was an observational study, not a randomized controlled trial, which remains the gold standard to establish cause and effect relationships. Our study was also limited to a single clinical center. However, our study has provided evidence demonstrating for the first time to our knowledge that a man with low-risk prostate cancer managed with active surveillance, consuming a diet consisting primarily of plant-based foods, may be linked with a reduced risk of prostate cancer progression. Our findings may help inform evidence-based dietary recommendations for men seeking to mitigate their risk of disease progression, which can in turn delay or even avoid prostate cancer radical treatments and the associated adverse impact on quality of life. Thank you very much for your time and attention.